I did that, and by the time I got the implants filled, I could not take some out of one side to make them even because it would have made one implant grossly smaller than the other. And I explained this to him, that I had done the best I could to get best shape, the most size I could out of them, and that's what my aims were. She had on one side, just for numbers, 300 cc's before I started, and I ended up with 430. That's over a third larger than what she started off with. On the other side, again, I put 430 cc's.
Do you have photographs for me?
I have preoperative photographs.
And I'd like to see the postoperative photographs.
I don't have any post-op. She did not come back from the post-op.
Some photographs.
Well, I'd like to take a look at...
Sir, stay right there.
Okay. Can I see the postoperative photographs, please?
May I say something, Your Honor?
Yes.
When we went to Dr. Cole informed us that he was able to put 400, the bag size, 400 cc's in her breasts and enlarge them to anywhere between, one side would be 450 to 460, the other side would be 490 to almost 500. When the doctor did the surgery, the only reason we even found out that he didn't put the right size in was because we asked for a copy of his report from his secretary. His secretary gave us a copy of the report. My wife was just devastated because he had not put the size that he indicated to us. We immediately went back into his office and said, "You didn't put the right size." He said, "Well, they no longer make that size."
Mr. Lucio.
Yes.
I can't use these photographs because these photographs don't show me anything. You showed me photographs. Your wife is wearing a brassiere.
Well, she was embarrassed to show you them without, Your Honor.
Well, then, that's not proof, sir. I need proof.
That shows you that I can't wear a bra.
No, it doesn't, madam, because I can, any woman can put on a bra, and unless she puts both sides in the same way, she can manipulate one side so one side looks one way and one side looks the other way. I have one set of photographs with the way you look preoperative, and I don't have anything here. You understand that, Mr. Lucio? I mean, what I have here is something that's masked, that's covered.
Well, we have a report, I'm sorry, from another doctor, Dr. Villicana. Wait, no, it's, if I may, just, Your Honor, it's just a...
Evaluation and the cost of what it would be to correct the surgery.
I am not going to read a report from another doctor. If you want to show me another doctor's bill, a bill I will certainly look at, but I will not accept another doctor's statement in lieu of the doctor's testimony.
We were charged for this doctor's report so that he could also, you know, show you that there is a difference just by looking at my
He says there's a difference. Madam, he says that there's a difference.
This is a drastic difference. I cannot wear a bra that's a normal size. One size fits and the other one does not. I would show you, you're a woman, you would just by looking at me. I can't wear a bathing suit. I can't wear anything that
Have you
is
been
normal
back to
size.
Dr. Cole?
We talked to Dr. Cole. The
Have
way
you
he told me is that every woman is basically odd-sized. You're not born even. And he said that there wasn't much difference. To me, there is a difference. Eventually, after talking to him, then he said, okay, I agree. He would go in and reopen the valve. When we spoke to the other doctor...
When he said reopen the valve, he meant reopen the valve and take some out from one side?
No, he was going to put some more in.
Madam, I don't understand you. You know, I'm looking at the procedure, the preoperative procedure, the preoperative photographs. And quite frankly, I don't understand why in the world an apparently intelligent woman would want to have her breasts enlarged any larger than these are.
You make intelligent choices. I made an intelligent choice. You may not agree, but it was my choice.
It was your choice.
बिल्कुल परफेक्ट चला रहे हैं बिल्कुल